And on that note, let's bring you this now. We know that at this point, COVID-19 cases seem to be increasing in Gauteng. That's bringing that strain over, particularly ambulances and other health facilities. I think even the closure of the Charlotte Maxeke Hospital has added on to that burden. Of course, that we've seen there, other surrounding hospitals also feeling that extra pressure with patients now having to divert to those hospitals. But because of this now, the South African Medical Research Council has called for the government to actually prioritise and to also improve emergency response and medical rates. And we'll unpack this right now with the director of the Office of AIDS and TB Research at the Council, Dr. Fareed Abdullah, who joins us now via Zoom. Thank you for your time, Doc. And good morning to you. I mean, I suppose let's paint a picture of the state with which, medical response, organizations such as ambulances and even health facilities are currently feeling at this time.
Good morning, Tumelo, and thank you for having me. I think my previous statement was quite specific about Gauteng, and what's going on basically is with the closure of Charlotte Maxeke, it has knocked out 300 to 400 COVID beds from the health system in Gauteng, and that has put the entire system under pressure. And what we're saying is that the way forward to resolve that is to open up beds in other hospitals. And for that, we need two things, really, in essence. One is additional nurses so that more beds can be opened up. But, you need a good, well-organized machinery with ambulance and emergency medical services so that people can be moved around to where there are available beds. Those people who would have been going to Charlotte Maxeke will now have to go to other hospitals.
So what's the strain now with ambulances? Because at this point, we do know they can't take the patients to Charlotte Maxeke. You're making note that they have to be moved to other, hospitals. Is this the only pressure that ambulances are faced with right now?
Oh, no. I mean, it must be a worse life under COVID to be an emergency medical practitioner. There are multiple problems. First thing is that an ambulance gets called to a home. Ambulance and emergency medical EMS personnel are expected to make a very difficult assessment if the patient needs the hospital bed or not, and then to know where to go. And they have a patient in the ambulance and no bed to take them to, trying to find a bed in any hospital. I mean, it's an extremely difficult situation. As you know, been many reports of ambulance services being attacked in communities, unnecessary calls being made for ambulance services. But what we're saying is that at the moment in this situation of crisis, where the third wave is well upon us, it's worse than the second wave, what we need to do is to invest more time, energy, personnel into ambulance services so that they can help patients to find the beds that they need for COVID-19.
Yeah, I mean, with that being said, I mean, I'm just thinking now, what comes to mind is the fact that some patients would need, oxygen. Ventilators would need to obviously be provided for. And I wonder if at this stage, our ambulances have enough of those resources to assist patients, particularly if, Doc, they have to be moved to an even further hospital when Charlotte Maxeke would have been a much more convenient hospital.
Yes, from my experience of working at Steve Biko Hospital, where we receive patients from multiple hospitals, I can tell you that I have seen the most incredible EMS personnel bringing patients on oxygen, but also on ventilators. So our emergency medical services are able to transport patients with a transport ventilator. You can imagine how difficult that is to do. You have to be completely covered in PPE because the patient is COVID positive, but you also have to manage a very sick patient who's in respiratory distress on a ventilator, moving them from one hospital to another.
Yeah.
So we have the capacity, we have the expertise, but we need more organization, we need more resources, we need more personnel to do this now. And I think that would make a big difference to moving patients around to the other hospitals if we have a good ambulance service. That means we need to be efficient about finding the bed for the patient wherever that might be.
Absolutely. And that, of course, call being made urgently from you, Doc. Thank you for talking to us. As the Director of the Office of AIDS and TB Research at the Council, of course, the SA Medical Research Council. That is Dr. Fareed Abdullah. Thank you so much for your time.